because I always forget to do that. I'm going to continue to let people in to the talk today. But first of all, I want to welcome you all to our research break at the University of Pittsburgh. If you're not from Pitt, we do a weekly research break with all kinds of different topics where we talk about works in progress, where students present their work. We talk about challenges we're having, but today we're really thrilled to have Susie Mapp with us today for our Pitt School of Social Work Speaker Series, which we have every year during International Social Work Week. And today, Dr. Mapp's going to talk about the Sustainable Development Goals, moving us from international social work to global social work, which is something near and dear to my heart. I am going to I'm just going to let some more people in. I'm going to introduce, or Bailey will introduce in a minute, Dr. Mapp, but just a few things to help our time together go a little more smoothly. So I'd really appreciate if you could mute yourself when you're not speaking. And that goes for me too, because sometimes my students hear me yelling at my cats to get away from the plants. So I too will go on mute. If you have a question, please either raise your hand or you can put it in the chat. We will be monitoring the chat box during that time. Dr. Mapp will also, in the spirit of sort of informality, has also put in a few break points. We do have an hour, a little bit over that. And I think we have to 1:30, but most people usually only have this lunch time. And let me I have some people in the waiting room, so I want to get them in. And let me see who I have. If Bailey is in yet. Beth, can you see if Bailey's in? No, okay. Yeah, she has a class. So I'm going to, again, in the spirit of getting started, I am going to introduce Dr. Mapp. So Susan Mapp, who very kindly responded to my absolutely cold call via email to presented this, is a professor of social work and the interim associate provost for institutional effectiveness and innovation at Elizabethtown College. She's written 2 books on global social work issues, human rights and social justice, and a human rights and social justice in a global perspective, an introduction to international social work, currently on its 3rd edition, and global child welfare and well-being, as well as authoring the book Domestic Minor Sex Trafficking. She's the author of numerous book chapters, peer-reviewed articles on a variety of topics, including the impact of war on children and violations of women's human rights, law enforcement, awareness of human trafficking, and issues related to the child welfare system. She's presented her work at numerous national and international conferences. She's the treasurer for CSWE Board of Directors, also 2014 CSWE Partners in Advancing International Social Work Education Award. And I didn't realize this, Susie, the co-founding editor-in-chief of the Journal of Human Rights and Social Work. So I'll make sure that we don't have anyone else in the waiting room. Hi, hey Bailey. So with that, I think we can get started. Susie, I gave you presentation rights. So, and Bailey and I will monitor chat and the hand. So, and we will let you know if anything comes up during, one of those pauses.
Fantastic. Yeah, I hadn't realized this was a more informal, so I did more of a formal piece. But definitely if there's anything where we need to pause and clarify, please feel free to interrupt me and let me know. But then I did build in some breaks. We'll pause, see if there's clarifying questions, anything that people want to bring up as we go along. But yes, I am the co-founding editor-in-chief of the Journal of Human Rights and Social Work. And my co-founding is here too, Shirley Catania Gable, and my inspiration. So let me go ahead and share my screen. So as you heard, my talk today is looking at how we can use the Sustainable Development Goals to help move us from international social work to social work. So last night at dinner, I was talking with my husband and telling him about this talk that I was going to be doing. And he looked at me very puzzled and he's like, but isn't that the same thing? You know, aren't international and global the same thing? And I was like, I'm so glad you asked, because that's my very first slide. So when we look at how does dictionary.com define international and global? International, as they say, looks at between or among nations involving two or more nations. So when we think about if we're traveling to another country, we go to the international terminal. That international, we tend to think of going other places to other people, another country. In contrast, global looks at the whole world. It regards it as a whole, that it's not more of an us and them. It looks at all of us together as a community. So the book that you saw Mary hold up was the second edition. As she said, I'm currently in the third edition of my book on the Introduction to International Social Work. So with these chapters, I'm looking at how do these issues occur in other nations, particularly nations of the global south. When we look at human trafficking, how do we see it there? When we look at war and conflict, how do we see it in other nations? I look some at countries of the global north, including the United States, such as how we work with those who have been displaced by war and conflict. How are we impacted by climate change and other physical environment issues? But mostly I'm looking at other countries, international social work. In contrast, this is the book I wrote about 10 years ago now that looks at global child welfare and well-being. So when I look at child labor, yes, I'm looking at how does it occur in Botswana or India, but I also looked at how does it occur in the United States. You know, we have children laboring on tobacco farms. We have children being trafficked here in the United States, as well as in other countries. So it takes much more of a global perspective. So that when we as social workers start looking at these types of issues, we may think, but these are huge, huge issues. How do we tackle such big issues? And the image I always use when we think about these is from Greek mythology. This is Jason of the Jason and the Argonauts fighting the Hydra. And the reason that the Hydra was so difficult to fight was that every time Jason would cut off a head, two more grew in its place. And that's how it can feel for us as social workers, that sometimes we feel like we're just getting a handle on something and two more issues pop up. So when we think about working with issues across countries and these major international issues, we can look to the United Nations. And what the United Nations did in 2000 was implemented the UN Millennium Development Goals. So these goals were derived from the UN's Millennium Declaration, which looked at a collective responsibility for global equality and equity. How do all the countries that make up the United Nations work together for this Millennium Declaration? And they used the goals to set clear and precise targets for achieving the commitments, because we know that what is measured is what attention gets paid to. So for those of you who are students, when you look at your course syllabus and you see that something is worth 30% of your grade, you're going to pay attention to that. That's going to have a major impact and hopefully a good amount of your time. Whereas something that might only be worth 5% of your grade might get less of your time, and something that's not graded you might not put a lot of time into it all. And so this was the idea behind setting the targets for the goals, that the UN wasn't just saying that these are good things to be doing. They are saying, this is where we're going and this is how we know if we got there. So they set 8 goals under the Millennium Development Goals. And the first 7 applied to countries of the global south. And the 8th looked at the countries of the global north. What could these countries that were viewed as further along in their development be doing to reach back and help bring the other countries forward? So these goals sunset in 2015, and so we can look at the targets to see what was achieved. So for goal 1, around eradicate extreme poverty and hunger, they aimed to reduce by half the proportion of people living in extreme poverty and exceeded that target, that we reduced it by 70%. They aimed to achieve productive employment and decent work for all, 61%, reduced by half the proportion of people who suffer from hunger. We achieved 44%. In goal 2, they aim to ensure that all boys and girls complete primary education, and we achieved 91%. Eliminate gender disparity in primary and secondary education was the only target under goal 3 to promote gender equality, though they did also track women's employment, participation in political processes. And we achieved the eliminating gender disparity globally, but when we look across regions, the progress was uneven. Goal 4, to reduce child mortality, we achieved a 53% reduction in that. So we did not hit the target of reducing it by 2/3. In goal 5, to improve maternal health, we reduced the maternal mortality rate by 46. And we did not achieve universal access to reproductive health, though we did improve it. For goal 6, to combat HIV/AIDS, malaria, and other diseases, we achieved a 40% reduction in the spread of HIV and AIDS. 80% of people who needed it were able to access treatment, and we achieved some reduction in the spread of malaria and tuberculosis. When we looked at ensuring environmental sustainability, that we saw greenhouse gases actually go up. We did not achieve biodiversity loss, though we did double the percentage of protected lands. We saw 63% of people who did not have access to safe water gain access, but only 30% of people were able to gain access to basic sanitation. But we had aimed to improve lives of at least 100 million slum dwellers, and we achieved 320 million. So as you can see, the progress was uneven, but substantial. But how does this help lead us from international social work to global social work? So if we look at the words of Jim Ive, he says that 20 years ago, he said, in a globalized world, all aspects of social work are affected by global issues, and all social problems have a global dimension. Hence, international social work can no longer be a marginalized specialization within the social work profession, but must be part of the day-to-day practice of all social workers if social work is to remain relevant to the pursuit of human rights and social justice. And this is the tact that the United Nations looked at. Because when we look at these issues are not limited to countries in the global south, that this may be the image that we have in our heads of somebody who lacks access to basic drinking water. But we can look at this headline from the Washington Post from 2019 to see that 2 million people in this country don't have running water. and that it is the traditionally marginalized and oppressed communities who are even more disproportionately affected by this. That they reported that Native American households are 19 times as likely as white households to lack indoor plumbing, with Black and Latino households twice as likely. And of course, we know that simply because somebody has running water does not mean they have safe drinking water. We simply need to look at Flint, Michigan as evidence for that. This may be the image that we have in our heads when we think about problems with air pollution, maybe India on the left or China on the right. But when we look at premature deaths due to air pollution, we can see that the United States is 7th on the list, with almost 200,000 people dying every single year prematurely due to air pollution. And these numbers are expected to only increase because of the loosening of regulations under the last administration. And once again, we see that our traditionally oppressed and marginalized communities are disproportionately affected by this. And here in Pennsylvania, this is despite the fact that our Constitution guarantees us the right to clean air and pure water. When you search poverty on Google Images, these are the types of pictures that you see. But when Philip Alston, the UN Special Rapporteur on Extreme Poverty and Human Rights, visited the United States, he found that 40 million US residents live in poverty, including 18.5 million who live in extreme poverty and almost 5.5 million who, in his words, live in third world conditions of absolute poverty. So now when we think about climate change, you may think, okay, well, this I know is affecting the United States, but thank goodness I don't live in California where they're having wildfires, or live in Arizona where we might see a desert that looks like this, or Florida where hurricanes come in. But once again, we can look at the disproportionate impact of people who are living in marginalized communities and see that those who live in traditionally redlined neighborhoods are bearing the worst impacts of climate change and the increasing heat. So this is a recent study that was published that, in their words, this study reveals that historic housing policies, i.e. redlining, may be in fact directly responsible for disproportionate exposure to heat events. And so what they found was that when they looked at neighborhoods that had been rated as highest in quality, i.e. whitest, that they were much cooler than those who lived in disproportionately redlined neighborhoods. And one of the major reasons for that is considered to be the tree cover, that there are many more trees in these quote unquote desirable neighborhoods, whereas there are fewer parks and trees in historically redlined neighborhoods. So we can see that previously redlined areas have an average of 23% tree cover, whereas those that are considered what they call green lined have almost double that, 43% tree cover. And this impacts not only people's physical health, but their mental health as well. So this is a headline from a new study out of Germany that found that more trees within 100 meters of a house is associated with reduced risk of antidepressant use. And this is especially pronounced from people living in socioeconomic statuses. So my mother is born and bred from Pittsburgh. I haven't been there since I was a little girl. So I would look to you all to look at this map of the historically redlined Pittsburgh neighborhoods and those that were what they call green lined, and then the in-between blue and yellow neighborhoods, to be able to say, you know, what does the tree cover look like in these areas? So let me go ahead and take my first pause for questions before we move on to start talking about how does the Sustainable Development Goals then build on this?
Hey, Susie, it's Mary Beth. So we have one question from the chat. Dr. Farmer, would you like to pose it, or do you want me to read it?
Actually, I think it got answered after I wrote it there. So I'm not sure I have anything to ask at this point on that
Okay.
particular. I thought the information on the global warming was actually incredibly interesting. So thank you for sharing that.
Absolutely. Yeah, it's one of those issues that we tend to not think about how it affects us, or now that we say, okay, well, this definitely is affecting the United States, but I'm right outside Harrisburg. And so we tend to get a little snooty sometimes, like, oh, this is somebody else's issue. This doesn't affect us. It's those people on the coast. But it definitely does affect us. And again, just throughout all these issues, folks have been traditionally oppressed and marginalized.
Bailey, can you see any hands raised? I cannot. No.
I don't. Let me see if I can change my view so that I can see you.
I just have a comment from Beth that Mulvaney, one of our faculty at Pitt, it's really helpful framing of these issues in nice context. And I would agree. Thinking about this and thinking about how I would reframe this in teaching. So yeah, this is super helpful.
Excellent. Yeah, and I'm glad to share those slides with anybody who's interested. That, you know, especially in my next set, I have some very pretty pictures for the Sustainable Development Goals. Barely got. Okay, so let me move on and talk a little bit more about the Sustainable Development Goals then, and how can this help move us forward? Because the UN is thinking, you know, these same things that they're looking at. Then how do we move to global? And so that was one of the big shifts when we start looking at the Sustainable Development Goals, is rather than segregating the goals from thinking about these apply to this group and this applies to this group, as we've just been talking, these issues are experienced by everybody. There is no country that has a handle on any of these issues. And so with the Sustainable Development Goals, these are things that everybody is working for. The other major shift is they said that this isn't acceptable, the way that we framed the targets in the Millennium Development Goals. When we look at the MDGs, as you saw, you know, we're going to have poverty, we're going to reduce this, we're going to lower this. And they're like, it's not okay that anybody's experiencing these issues. If we truly want to aim to have a world in which human rights are realized, no one should be experiencing poverty. No one should have hunger. And so the Sustainable Development Goals shifted to eliminate disparities. And they said that in order to achieve these goals, we need to have three undergirding principles: human rights, gender equality, and the rule of law. They said that if we're going to achieve these, we must have these three things. So that developing the SDGs was a worldwide process, that there certainly was a central coordinating panel. You know, we certainly saw participation from various governments, but everybody in the whole world literally was invited to participate. We had school children participate in developing the SDGs. So through this process, they developed 17 goals to end poverty in all its forms everywhere, to end hunger, achieve food security and improve nutrition, and promote sustainable agriculture, ensure healthy lives and promote well-being for all at all ages, ensure inclusive and quality education for all and promote lifelong learning, achieve gender equality and empower women and girls, ensure access to water and sanitation for all, ensure access to affordable, reliable, sustainable, and modern energy for all, to promote inclusive and sustainable economic growth, employment, and decent work for all, build resilient infrastructure, promote sustainable industrialization and foster innovation, reduce inequality within and among countries, make cities inclusive, safe, resilient, and sustainable, ensure sustainable consumption and production patterns, take urgent action to combat climate change and its impacts, conserve and sustainably use the oceans, seas, and marine resources. Sorry, the Zoom's sitting over that one. Manage forests, combat desertification, halt and reverse land degradation, and halt biodiversity loss. Promote just, peaceful, and inclusive societies. And then revitalize the global partnership for sustainable development. So the reason that these goals can help us address the Hydra's head is that because each goal is important in itself, but they're all interconnected. So when we achieve gender equality, we help to end poverty. And when we help to end poverty, we help to end hunger. We help to ensure access to water. We help to reduce inequality. So rather than cutting off one head and getting two more in its place, we can cut off one head and cut off more heads at the same time. So by when we make progress on one goal, we help further progress on another goal. So we're now about a third of the way in to the SDGs. They started in 2015, run through 2030. They have about 169 targets, so I'm not going to go through all the targets. But when we look globally at progress on the SDGs, this is where we see that we are. So we don't have any green, which would mean that we have achieved that goal. But you can see that yellows are where we have some challenges remaining. Orange is where we have significant challenges, and red is major challenges. So we have 4 on which it looks like we're making good progress, but then the rest of the 17 are either orange or red. And when we look around the world, the US ranks 31st in the list of countries in terms of how well it's doing on achieving the SDGs. So this is specifically looking at the US progress. So the United States is making good progress on 6, 8, 9, and 11. We're making progress on a number of the others, but you can see that on 15, in terms of protecting life on land, we're actually losing ground. So a lot of work to be done in our country. And of course, these assessments were done before we really started looking at the impact of the current pandemic. So as you saw with the MDGs, that there had been a noticeable decrease, 70% decrease in terms of global poverty. We're now actually losing ground for the first time in terms of global poverty. And the outlook keeps looking worse, of course, as the pandemic goes on. So I highlighted the key phrase from this report from the World Bank from January, that they now expect people to be pushed into poverty as a result of COVID, about 120 million newly poor people. So these people were not poor before the pandemic, but now are expected to become poor. And these are data from the New York Times looking at the impacts in the United States, that once again, we see traditionally oppressed and marginalized group experiencing a disproportionate impact. That when we look at the change in employment, that we see only a 1% loss of employment among the wealthiest quartile in the United States, but over a quarter among the bottom 25%. And racial differences among that, with currently Blacks being the most impacted group, followed by Hispanics, and then whites. They only included these 3 groups and their data. So the good news is, for those of you who are out in Pittsburgh, that Pittsburgh is a leader in the Sustainable Development Goals. That Pittsburgh was one of the very first cities to adopt the Sustainable Development Goals. That Pittsburgh said, if our country is not going to work on these, we are going to work on these. So these are some newspaper headlines and then a report from the Brookings Institute looking at the work that's being done in Pittsburgh to try to achieve the SDGs. This was a LinkedIn from a particular fellow as I was searching Sustainable Development Goals in Pittsburgh. I thought that this was really neat, that they had a Sustainable Development Goals fellow at the city, although I would ask why this person is a political science major and not a social worker, of course. One of the things that this person worked on during their time there was Pittsburgh's voluntary local review that was completed this fall to examine Pittsburgh's progress on all 17 of the goals. And they took each of the goals and then offered a little explanation of it, talked about what they were doing, and then examined how well the city departments were aligned with that particular goal. They did not talk about social work, although they did use this report that was a product of y'all's Center on Race and Social Problems. University of Pittsburgh issued a report in 2019 looking at the work that it was doing to help achieve the goals, and particularly mentioned the school under Goal 10, noting that the School of Social Work advances and applies knowledge for the prevention and amelioration of social problems, and again, particularly noted the work of the center. I was sad that this was the only place that social work was mentioned, since of course, social workers are helping to make progress on most, if not all of these goals, eliminating poverty, eliminating hunger, reducing gender inequality. But then when I went to the center, the love was not returned. I searched on Sustainable Development Goals, and this is what I found. So I would hold up Carnegie Mellon. They were the first university in the country to conduct a full review of what they are doing to help to achieve the SDGs. So let me pause there for questions before we move on to then start thinking about how do we use social work and human rights to help achieve the goals.
Susie, I'm just looking in the chat. People were, thanking you for your willingness to share the slides, and they really are awesome. I'm thinking that I'm going to replace this lecture with the one I do on the SDGs. So thank you. But we were just saying that I personally had no idea that we had that document, and I was saying it's time to get a social worker there. I mean, nothing against political science, but I do find that our students don't always realize that these spaces are places where they can really have an impact. So we were just saying, yeah, we got to get a student there. Are there any other questions? You can unmute yourself. I don't see any hands being raised unless I'm missing that, but.
Hi, everyone. My name is Catherine Vargas. I'm a social work alumni. I graduated in 2008 from Pitt, and I work at the City of Pittsburgh as the Assistant Director of City Parks, and had the opportunity to be a part of the voluntary self-review this past November. I'm newer to the city, so I've basically, most of the time I've been at the city, we've been in COVID doing our work. But I did have a question about the trend. You mentioned that Pittsburgh is one of the first cities that adopted these goals as something to review locally. I do think that, when I think about some of these goals, they're so big and so, you think to yourself, like, in our department, we do a lot around foods, food distributions and supporting families with food during this time that we've been in COVID and kids haven't been in classrooms. But then the issue of food insecurity is so large. I'm just using that as an example. I wonder what the trend is for folks to pare that down to these like local communities, having discussions about these goals and actually, digging into it the way that, we had it. I personally found it very refreshing in, being newer to the city in my role to go through the process of doing the voluntary review about how does our office actually tackle these issues and what can we do better? But I wonder what the trend is there, because I do kind of feel like local, when local communities come together to address issues like that are so big, that like together those local efforts can have a bigger sustainable impact on what that overarching United States number might look like. And I was just curious to see if you have noticed trends, maybe even not with cities, but in other like local communities that have been coming together to say, hey, like let's get together and set goals around these big issues.
Yeah, no, I think that local adoption of the goals is still fairly rare. So I don't think that there's very many places that have been doing it. That I think that, with lack of national leadership, we haven't been seeing the type of progress that we'd like to be able to see on that. So it's really interesting. I love hearing your perspective, though, from somebody who went through that review and started looking at it.
Yeah, I started doing a couple of different things. And I definitely want a social work intern. Once COVID's over and like I'm back in like a normal situation, that has been one of my goals for sure. Every place I've worked, I've always had social work interns if I can. So I'll definitely connect on that as well. Sorry, I was looking in the chat. But I will say that, because of doing that process, I did start to pay closer attention to like the Food Policy Council, which is a local effort to work on, creating food sustainability in our local region. And that wasn't something that I had thought of before. So I do think, hopefully with some renewed national leadership in this space, it would be really interesting if there is a trend built around local communities really tackling these issues, because I do think that's when you start to really get to the work that impacts people. And that's the part that I always think sometimes can be missing. Like even from our report, you might read that and say, okay, city, like this is great. But when but it's hard to like, until you're in it, to see it as a way that you like change the way you do your work. And then I'll also just kind of mention, I agree that I think the social work perspective is really important in these conversations. And not to say that a political science perspective isn't also valuable, but I do think that the social work perspective brings a different lens to it. So thank you for hosting this conversation.
Oh, it's my pleasure. And I completely agree that, yeah, I mean, we want to be working interprofessionally because all of the professions have different perspectives, and all of us working together is what's going to help us be able to move things forward. But as I talk with my students, sometimes we get so ingrained in thinking that everybody thinks with a systems lens, and that systems thinking just comes naturally to everybody. But that's not the case. It's by using our system lens and thinking about, well, how does it impact this person or these family and this community and the state, and how does this all fit together, and how do we pull together all these different pieces? That's something we've just learned to do as social workers, and that's not something that's inherent in every profession. So it's definitely something that we really bring to the table by working with our systems lens. Oh, and awesome on banning the single-use plastic bags. Yes, they and disposable water bottles are my bane. I've actually banned disposable water bottles from my classroom.
This is just Mary Beth. One last comment in teaching global perspectives, and this is the first time I've ever taught the class, actually. Interesting during also the situation we're in, but I find it really interesting. It's both undergraduate and graduate students, social work minors and majors. Social work students don't always feel, even though we do have social workers in this space, in a way, the students don't always feel like they have a right to be there. it's the only, like we're social workers, right? While they have a system lens, I think they tend to think sort of micro practice, and a big part of our work in the beginning was about, you don't have to be weighted. You don't have to be invited to go in there. And secondly, you do have a lot to add to the conversation. So I think that's also a clear message we need to give. You shouldn't be necessarily taking a class in global perspectives to hear that. You should hear that right away, whatever class you're in. So there's one more message and then we'll go. So thanks, Catherine. So glad you could make it, and we will be really happy to have an intern with you. All right. So go ahead, and we'll.
Yeah, I've got my teaser slide up. How do we make this happen? We make this happen going back to where we started. We look at the United Nations. So this is a photo of Eleanor Roosevelt with the new Universal Declaration of Human Rights. That declaration was developed after the atrocities of World War II, the Holocaust, where we saw people being murdered, detained, forced labor on the basis of individual demographics. Primarily religion, but also political opinion, membership in particular ethnic groups, such as the Roma community, sexual orientation. And after the United Nations, brand new, said, this cannot happen. We cannot have people having their basic rights violated on the basis of these individual differences. And so they developed the Universal Declaration of Human Rights to say, this is the minimum that people must have in order to be able to live a full and productive life. This is the floor. This is the absolute minimum. And this cannot be divided on the basis of any category of difference. So human rights are designed to be universal. The United Nations also said, this is not a buffet. You cannot pick and choose which of these rights that you're going to support, that they are indivisible. And I would particularly call your attention to Article 25, where it states that everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care and necessary social services. And I highlight that one because, as Jay McPherson likes to say, it guarantees you the right to a social worker and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood. So we don't pay a lot of attention to human rights here in the United States, but our international group does, the International Federation of Social Workers, that in their definition of what is social work, that they particularly note that human rights are central to social work. The codes of ethics of a number of other countries specifically mention human rights, although our NASW code of ethics does not do so. So then when we look at how do we use human rights to work towards achieving these SDGs, we can look to the work of Shirley Gattegno Gable, where she looks at how do we set up service provision from a charity-based perspective, a needs-based perspective, or a rights-based perspective. When we start looking at things of who gets services, how do we view people who use services? Why do those who provide services provide them? And so if we look at this, we can see that from the charity-based approach, this is very similar to our historic roots as social workers, our charity organization societies. We start looking at the idea of deserving, our worthy and unworthy poor. Where does this come from? Why do people help? Whereas a needs-based approach is much more common now, but we should be evolving towards a rights-based approach. That the needs-based approach says that folks who are assisted, that we are helping them based on charity or their evidence of need. But a rights-based approach says these are things to which they are entitled by the simple fact of their humanity, that they do not need to demonstrate that they need these things, that they are deserving of them, that they have a right to them. And that we then assist them, not because we want to, but because this is a legal requirement to be able to help people achieve their human rights, that they are not needy, that we are addressing human rights violations. And so as Jane McPherson says, that using human rights in practice then requires that clients be brought into partnership with social workers in search of solutions to their problems. And it insists that social workers engage in political struggles alongside their clients. So David Androff then takes this and he developed the rights-based approach with its core principles of human dignity, non-discrimination, participation, transparency, and accountability. So given our time, I'll go over these quickly, but I would refer you to his book for more detail. So human dignity, similar to what we saw with Catania Gable, views clients as rights holders who seek services due to human rights violations, and that social workers, rather than dispensing charity, are helping people gain things to which they are entitled by their humanity. And so here we're including our concept of self-client self-determination, that they get to decide what happens to them in their life. And Androff uses this Mandela quote that overcoming poverty is not a gesture of charity. It is an act of justice. It is the protection of a fundamental human right, the right to dignity and a decent life. Non-discrimination harkens back to the idea that human rights are universal and that they reflect the dignity and worth of the person. So here we are not only using our idea of intercultural competence, but we are also working to strive to make sure that these services are non-hierarchical. That it's not that I am coming in as a social worker with all my training, and therefore I'm going to help you, poor pitiful client. It is how are we partnering? And he uses the quote from Lila Watson, who's an Australian Indigenous activist, who said, if you are coming to help me, you are wasting your time. But if you are coming because your liberation is bound up with mine, then let us work together. Participation means that services should be centered on the voices of those who are being affected by these rights violations, giving them access to power and building capacity in those communities. So here he uses the quote made famous by disability activists, nothing about us without us is for us. Transparency means that we are clear, we always maintain clarity in terms of what we're doing, that we ensure that affected communities have access to information they need, and that we're also conducting assessment about what is occurring. What are the human rights violations? How broad are they? Because it's usually not just one person who's experiencing these human rights violations, it's often a community, as we saw when we looked at the problems, that it is our historically oppressed and marginalized communities who are disproportionately bearing the burden. And we need to be documenting that. And then what is being done to address those issues? What are we as social workers doing? And how are we advocating to make sure that there's redress? And accountability looks at the idea then of holding people accountable for their actions, that if there are violations, somebody was violating those rights, and that we are working as activists to prevent future violations of human rights. So if we look at then, how do we pull all of this together? We can look at a case study. So I didn't put it in Pittsburgh, I put it back in Houston because that's where I spent a number of years before I came back up to Pennsylvania. So Felicia is a 55-year-old Black woman living in the 5th Ward of Houston, which is a traditionally red-lined neighborhood. She owns her home, a 100-year-old house that lacks central air conditioning or insulation. She relies on window units. In January 2020, she took a new job with the US Census Bureau and was looking forward to the higher pay and better health care benefits to help care for her youngest son's asthma. However, she was laid off from that job due to the pandemic. She says she was okay through last summer due to the additional unemployment benefits, but has greatly struggled since they ended. She has been able to pick up some work here and there, but nothing sustainable, and has struggled to put food on the table. She is seeking help now due to the enormous bill she is facing from the deep freeze Texas experienced in February. Her water pipes burst and a plumber can't come until April. Additionally, she is facing an electric bill of about $3,000 as a result of Texas's deregulated system. She is terrified thinking about how to pay the coming summer bills with no steady job, and reports she is struggling with anxiety and depression as a result. So then when we look to the SDGs, that when I only looked at the directly relevant ones, I still came up with a list of 10 directly relevant SDGs in terms of poverty, hunger, health, water, energy, decent work, inequality, sustainable cities, climate action, that these all come together in this one particular individual that we're looking at here. And then if we were to start then looking at how do we apply the rights-based practice approach to then be making progress on the SDGs, that we make sure that we're operating from a rights-based approach, that she is seeking assistance because her rights are being violated. And we need to make sure that we include that in her assessment. We need to make sure that the way services are set up preserve her dignity. And we need to recognize the current and historic discrimination that has helped place her in this position and work alongside her as an equal partner to address this rights violation. As part of that, we make sure that she understands the historic factors, because certainly these are things that people have purposely worked to obscure, and helping her to understand that these struggles are not due to individual weakness, which our US culture would say, but there is a larger system that is blocking access to her human rights. And then we look at working with the broader community, because she's not the only one who's experiencing these issues. So how do we help build capacity in the community to help them advocate for their rights, to help move them from passive recipients of charity to active change agents working to realize their human rights? We help them document the violations that are occurring in the 5th Ward and other similar neighborhoods. We work alongside those who are experiencing the rights violations, so our actions are clear at all times. And then we advocate for the leaders whose actions led to this situation to be held accountable, and we work to change policy to help prevent future violations. So for those of you who are like, but wait, I was promised international social work, I would give you this slide. But in all honesty, it is only by viewing our cities and our country here in the United States as part of the broader world that we will be able to move forward as a whole community to achieving the SDGs. Because international social work, international is often seen as going other places to help other people. But we are beginning to see other places and people as part of our communities. And as we expand this concept, we'll be able to understand these others and their experiences as part of us and our community. And so I bring you back to Eleanor Roosevelt, who said, "Where, after all, do universal human rights begin? In small places close to home. Unless these rights have meaning there, they have little meaning anywhere. So that's the end of my formal talk. We have a little bit more time for discussion and conversation.
So there was a question from Yodit. So Yodit, you had a question about, I just lost my chat screen when I moved here, about moving from the, go ahead, you can say it better than me.
I was just really interested in the shift from the charity model to the need model, then to the rights model, and what has helped folks move in that direction, because it's really nice to see that. And is that an approach that most people have adopted, or is that an emerging approach?
I wouldn't even know if I would call it emerging. I would call it a hopeful. So Shirley, I'm going to look at you and see if you want to speak in, because Shirley McDaniel Gable's here. So
okay, I was like, yeah, I like that. When do they do that? That sounds good.
Hi, everyone. So I think that, the move from charity to needs was part of the rational decision-making movement of the 20th century, where we wanted to gather evidence and use it in the way we made decisions, particularly in public policies. And that was very important and influenced, I would say, all disciplines, that we used a more scientific approach. And that really solidified the needs-based approach. But along the way, it created this group of experts who had all the information, and everyone else that had to live by the opinions of the group of experts. And so the needs-based, moving from needs to rights, it's certainly very popular at the United Nations, right? As all countries are asked to embrace human rights. And I would say that it's very uneven at best in the United States.
Thank you.
Yeah,
but one more thing I would add to that is that, the participation research methods that we used, and that is very much echoes the idea of the rights-based approach. So it is gaining popularity that way.
Yeah, that was the major shift I made in my book in the second to the third edition, is really integrating the rights-based approach throughout. So I pumped up the chapter on human rights, but then integrate it throughout the other chapters, because historically there has been a lot of, we decide what services are being offered and we decide how we know if those services were successful, and not including the voice of the people who we're working with.
Right, or you have to demonstrate how bad things are for you, right? So I think that's what I often find, is that people have to sort of grovel or really sort of talk about their folks in a pathological way that doesn't allow them to have a seat at the table and with dignity.
Exactly. If you think about the fact that we usually do needs assessments rather than asset mapping.
Yeah, yeah. And there's just sort of a whitewashing of all of that. So that was super helpful. Thank you.
Any other thoughts or questions are coming up on 1257? I'm really excited to hear about this new book, because I've had to sort of use David Androff's book and your book. So the fact that, just sort of hit both the human. So it's really great to have that perspective in one place. Students have been really open to sort of both of those together. So I'm really happy to hear that.
Yeah, Shirley, David, Jane McPherson, and I all do a fair amount of work together. So we actually had an article come out in Social Work, I guess it was summer 2019, Social Work is a Human Rights Profession.
Yes.
Basically calling out NESW and saying, y'all went through this whole revision of the Code of Ethics and you still didn't talk about human rights.
Yeah, we could probably go on really another hour about sort of why that is, but I'm aware of time. But I think it's a very interesting question that is worthy of probably its own research break. So, Mary, you just had Mary Omer. Just want to close it out. You had a comment about.
Yeah, I was just looking at her comment about asset
Yeah.
mapping. It's fantastic.
The chapter in the regular encyclopedia social work was community needs assessment. We took the needs out, and it's all strength-based, asset-based approaches for assessing communities. And the new macro encyclopedia chapter, doctoral student Emily Underwood and I wrote, just submitted. So we're really happy about that.
Fantastic. Yeah, because we do so much work on what's wrong with people.
Yes.
And it's like, we're supposed to be a strength-based profession. Fantastic. Thank you for that
I love the way
contribution.
you talked about rights. And I think the strength and asset-based approach in social work goes right along with that. And I think it's so important. So thank you.
Absolutely.
Any other questions? No? I'm just scrolling through, or hands raised. No? Well, I would love to thank you everyone for coming today from, the other schools, from Gwinnett, Mercy, and our alumni, our faculty and students. This has really been a great hour. Thank you, Susie, Dr. Mapp, for really making us think. Thank you for helping me think about how to, if I teach this class again, how I want to reframe certain things. So, and rethink things also for myself. So thank you for a really thoughtful hour. I do have, I will send out Dr. Mapp's email address. If you, have any follow-up questions, we'll put them together and send them to her. And this is recorded and we will make it available. I'll talk to Shannon, but it will be on our website. So thank you everyone for, for participating, and have a great International Social Work Week. I just want to point out there's also social work at the UN coming up. And also on Friday, there's also some presentations and work you can sign up for. Geneva time, we can pretend we're in Geneva, even though we're sitting in Pittsburgh. So if any of you are interested, just send me an email at MAR104 and I can send you to where you can sign up for this event. So thank you very much, everyone.
Thanks for having me. Take care.
All right, bye.